Okay. Good afternoon, everybody. I hope that y'all are having a wonderful day. If you were on right now, I will put the continuing education, if you're live with us right now, I'll put the continuing education for you. You don't have to worry about it. I'll make sure that you get credit for it. If you are rewatching the video, if you want to text me, email me, or call me just to let me know that you have watched it, I'll go ahead and I'll also input that continuing education as well. So we do have Dr. Maria Iyecas, right? Said it right. She is the coordinator for behavior and mental health, and she's going to kind of be talking. She's with Driscoll Hospital. She's going to talk a little bit about their program and how maybe we would be able to utilize them for our CASA kiddos. So Maria, if you want to go ahead and get started.
Okay, thank you so much for that wonderful introduction. So, yes, my name is Dr. Maria Iescas. I am the Behavioral and Mental Health Coordinator at Driscoll Children's Hospital, and I am so excited to be able to share with you all the information, all the different services that we provide that could help you, of course, with your kids, with your wonderful volunteers that you have, and also your fantastic colleagues. So, I'm going to share my screen. And we will get started. Okay, hold on just 1 second. Oh, sorry about that. All right, can y'all see this?
Yes.
Okay, so I'm with the Department of Behavioral and Mental Health. And here is my fabulous team that I have. So like I said, mentioned before, I'm the coordinator. We have Miss Lisa McKenna. She is our Director of Clinical Practice and also of Therapeutic Arts. We have Miss Monica Lozano. She is our mental health educator, but she's also a mental health specialist here. We do have several mental health specialists, and I'm going to go into detail in just a little bit about all the things they do for our kids and for our staff here at Driscoll. So we have Dr. Stephanie Majors, we have Caitlin Wagner, we have Carolina Ensminger, we have Sergio Garcia, and Katrina Barnes. And then we also, which is fabulous, we also have an art therapist. Her name is Haven Wright, and we recently just got a music therapist as well. Her name is Miss Robin Blue. So this is the team, well, half of the team. Okay, we have a two-pronged approach. So what we do is we provide mental health resources and services not only to kids in the hospital, but we also provide services to kids outside of the hospital as well. So we do have a mental health school program, and that's the program that I'm in charge of. And these are my wonderful team members that are here. And what they do is they actually provide free therapy, individual and group therapy to kids of selected schools of CCISD and also to Gregory Portland Middle School. So here we have Dr. Ludi Allred. She's at Morellis at CCISD. Christy Esquivel, she's at Moody High School of CCISD. Brandy Kircha Shaw, CCISD. Audrey is at Cullen Place, CCISD. Hannah is at Travis, CCISD. And we have Alex Garcia. She is our newest team member. She is also at Berlanga at CCISD. And we have one lone wolf who is doing some great work over at Gregory Portland Middle School. Her name is Stephanie Luttrell. So not only did they support the children in these selected schools, this is a grant-funded program, but they also are all accredited in the Positive Parenting Program. So they can provide parent education and resources as well, but they also provide support to the faculty and staff of their schools. So this is fairly new. We are finishing up our second year after this school year's over. And y'all let me know if you have any questions and we can stop anytime I need to. So the mission of our mission is to support the behavioral health needs of South Texas region by providing high quality behavioral health care, screening, intervention, and connection to services for Driscoll Children's Hospital patients and also in the Coastal Bend community. Our vision, we envision a vibrant and resilient community where mental health concerns are acknowledged and appropriately addressed, leading to improvements in quality of life. So what do we do? I'm just going to quickly go over this because I am going to go into more detail in the slides that follow. But we provide assessments, we do screenings, we provide interventions, we connect families and students to services. We also provide mental health support to the staff here in our hospital. We do individual counseling and we also do some crisis counseling. We also have a comprehensive response, which makes us very unique. So we focus on prevention. So with prevention, we do 7 and 30-day follow-up. So what those are those are some phone calls that we provide 7 days after a kid has been here, and also 30 days after that same child has been here. So let's say they were in our emergency department for suicidal ideation. Fleeting thoughts, no real plan, no real intent, but they do need some kind of extra support. So let's say that we have referred them out to some counselors in the community. So what we'll do is we'll call them up, see if there's been any barriers to receiving those counseling services, and maybe there's new services, new needs that also have come up with their child. So it's just great to have these phone calls to do those check-ins to let parents know that we're still here. You might have left the hospital, but we're still here to support you and to support your child with whatever you need. So those phone calls are really great to just help us to provide extra service. We do PHQ-9 screenings. So those are depression screenings. This is also something that's fairly new in our hospital. So any child between the ages of 12 to 21 who visit our clinics, they actually fill out, it's not required, but most of our kids do this. They fill out a depression screening tool. And that really does help us with prevention because if a child scores pretty high on it, that's kind of a clear indicator that maybe this child is suffering from depression or is suffering from anxiety. So then we can make the proper steps, whatever that case is with that kiddo. Like I mentioned, we also have our mental health specialists in the schools, which is great because a lot of what they do is prevention. They're providing that therapy during the school day at the schools. So parents don't have to leave work, kids don't have to leave school. They're not missing any schoolwork as well because it's usually during PE class, art class, but they're able to address these problems ahead of time before they snowball into something bigger. We do promotion. So we normalize behavioral health considerations and interventions. We want everyone to know that mental health is health, right? We want to destigmatize mental health as well. So we want to normalize it as best as we can. And we do this a lot of times just by talking, like right now, talking to you guys here and having open conversations about mental health. We facilitation of patient connection to relevant services. So sometimes our students need services beyond what we can provide for here in the hospital. So we do make those connections to different resources in the community. We have interdepartmental communication regarding behavioral health services. We talk with everyone in the hospitals. Our clinic nurses will make recommendations like, hey, Maria, there's a kid up here. He seems really upset, seems really sad. Do you mind coming up and visiting with him? Great. So people know who we are. So in that, when they know who we are, they know what we do and that we can go up and we can help these kiddos who are in our hospitals or who are in the emergency department as well. We do community outreach just like this. We meet with various community agencies. We talk about the services that we can offer. And also, we find out what y'all do, what our agencies do. So we know some of the resources that we could refer our families to. We do early intervention. So once again, those PHQ-9 screenings, super important. So we can have that early detection and we can intervene early if a child does score high on the depression scale. We do provide brief crisis intervention, especially in our ED clinic. We're the ones that go in and do those mental health assessments in the ED clinic for those children who have suicidal ideation, threats of harm to themselves, threats of harm to their others, or maybe they're in a state of psychosis as well. So we do provide that brief crisis intervention. And we anticipate a behavioral health needs for individual cases as well, especially when we have kiddos who come in kind of frequently and it's our same kids. We kind of anticipate what this child's going to need. Not that it's always the same, but we kind of get to know some of the kids that come in frequently. And so we kind of do anticipate what they do need from us. Okay, as I mentioned before, we do assessments and we do screenings. So this is done in our ED, all throughout the hospital and also in our clinics. So as I said, the mental health specialists here in the team that we have, they really probably spend about 80% of their time in our emergency department with those kids who come in with suicidal ideation, with threats of harm to others, with states of psychosis as well. But they also are going and doing bedside counseling. They're doing assessments to kids that we receive consults for. We also do it in our clinics. Sometimes when a child does score high on their PHQ-9, and it indicates that they have high depression. Then, and also if they also indicate that they have suicidal ideation with a plan and with an intent, we go in and we do a full mental health assessment for them and a full screening for them as well. So that way we can provide them the support and the resources that they need. So we have a variety of screening tools that we use. As I mentioned before, the PHQ-9 is our depression screening. We do the Columbia Suicide Severity Scale, especially for those students who do indicate suicidal ideation. We do our GAD, which is an anxiety. So a lot of times when our kids score high on our PHQ for depression, there's usually some anxiety going on as well. Or, we like to have conversations with the kids also, besides just going in there and doing a survey, right? We have conversations with the parents. And a lot of times they'll tell us, like, I have anxiety or I feel anxious. And so at that point, if they have not been diagnosed, then we do give them this GAD survey just to see how they score. And it could indicate that maybe they do have anxiety. And so that's another conversation that we can have with the kids and also with the parents. We do the Edinburgh with our postnatal depression. So one of our mental health specialists, I'll talk about in just a minute, but she does work with our mamas here who have babies in the NICU. We do the S2B1, which is substance use, because we do have kids who come in who have overdosed sometimes or do have addiction. And we do, of course, provide services to them. And then our QDIT-R, that's our cannabis use disorders identification test. We're seeing a lot more of this, kiddos using marijuana, either to self-medicate or they think it's cool and they become addicted to it. So we're seeing more use of these substance abuse surveys. Our assessments that we have, consultation on disposition for emergent crisis. A lot of times when our kids are in the ED, it's because they've hit a crisis point. They've hit a point where either they go in and they tell someone, they reach out for help, or someone that they love can no longer feels like they can support them the way that they're supposed to have. So we go and we provide support to those kids, but also to the parents. The parents and guardians are scared. They don't know what to do. They don't know who to go to for help. They feel alone. They feel isolated. So, us going in there and helping them during that crisis situation, letting them know you're not doing this alone. We're here to support you. If we can't support you here, we will definitely, make those referrals to other resources, but we're going to help you to reach out to those resources as well. And we're going to check in on you in 7 and 30 days to see anything else that you need. We also provide opportunity for improving insight. Just last week, I was visiting this little girl in a clinic, and she was telling me, I just feel like I just, my head, like the thoughts won't stop racing and my heart starts beating. And she was basically describing a panic attack. She was saying that this happens when she's in public situations. And so I mentioned that to her. I was like, you know what? This sounds like a panic attack that you could be having. She had never heard of that word before. She didn't know what she thought she was going crazy. That's what she's like, man, I feel like I'm going crazy, miss. And so just providing that insight to them so then we could have a conversation on how to cope. Like it says here, an opportunity for coping plans. We were able to come up with a coping plan for her, also referring her to different services, counseling outside of what we do here, but some things that she could do in the meantime that, some breathing, some muscle relaxation, guided meditation, things like that. We do provide interventions, of course. We provide counseling, as I mentioned. So we do motivational interviewing while we are in there talking to the kids, talking to the parents, also guardians. We provide solution focused brief interventions. Unfortunately, we can't provide long term counseling here. We just don't have the capabilities or the staff to do that. So we do have to refer out for things like that. But while they're here, we can provide that service, especially if they're in the hospital for a while and they're depressed, they're anxious. We can go do that bedside counseling with them. We can do very brief counseling when they're in the emergency department and maybe they do need to have a referral outside to maybe even a psychiatric facility. While that child is there, we can provide that intervention for them. We do a lot of psychoeducation, a lot like what we're doing right now, just educating people on who we are, what we do, about mental health, what to do when your mental health is failing as well, and the different resources that are out there. We do parent coaching. As I mentioned before, our parents sometimes don't know what is happening. They don't know what to do. So we can coach them and let them know, these are the resources. These are some of the things I'm seeing in your child. This is what the survey score shows, what it indicates as well, because this could be really scary for parents who are navigating this new ground of mental health. So we want to make sure that our parents have the resources and the education. We also a variety of intervention strategies as well, like I mentioned before, some of the ones that we talk about, like breathing with them, talk about journaling, things that the kids can do on their own. And then we also have therapeutic arts, which I will talk about in just a minute. So, disposition and our discharging. So, we work with safety plans with our kids, and you'll see an example of one of those in just a minute. But for a child who does have suicidal ideation, if it's just fleeting, or even if it is, something that's constant that's happening, we do come up with safety plans for those kids. So, if they are released to go home, they're safe, and their parents and guardians know how to keep them safe as well. We refer to outpatient counseling if a child does need that. We also we refer to online intensive outpatient programs. A lot of our kids, especially during COVID, they got used to talking to someone via the computer, right? And they feel, comfortable. They're inside their home. Sometimes they're in their bedroom able to do this. So some of our kids really do flourish with that online programs. So we do have various online programs for counseling that we also refer our kids to. We refer to intensive outpatient programs as well. Partial hospitalization programs. So that's where, a child maybe spends half the day receiving counseling services, and the second half of the day, they're actually doing schoolwork. Of course, in a very, um, kind of a restricted environment where there are counselors available for them if something happens. Their teachers are also there for them. We also make recommendations for residential treatment programs, especially our kids here who are addicted to drugs or addicted to alcohol or have an eating disorder. We do have to refer them. And then we connect them to any kind of relevant resources and supports that they may need. So this is an example of our Stanley Brown safety plan. So as I mentioned, it's a brief intervention to help those experiencing self-harm and suicidal thoughts. It's a concrete way to mitigate risk and increase safety. So we actually sit down with the kids and we fill this out with them. So for example, it says here, what are my warning signs? What are my triggers? That way the kids are aware, like, hey, listen, when I start feeling this way, I need to pull out the safety plan. It says here, what are my internal coping strategies? And so that's things that we teach with them and we go over them with it. People that can provide distractions for them when they are having these thoughts. It says people who I can ask for help during a crisis. We always try to put down someone at school and also someone outside of school. So they're safe, anywhere that they're going. And then professionals or agencies I can contact during a crisis. So they do have those numbers right then and there if they are in a crisis situation. And then making the environment safer. What can I do? And we always give this to the child. We give this to the parent as well, so that the parent knows about the plan. And if they see their child having any of these warning signs, hey, let's pull out the plan. Let's talk about it. So it just kind of gives it's a concrete thing. We have some of our kids who keep these in their binders as well, in their backpack, in a folder, something they can pull out really quick. We connect to services, as I mentioned, we connect counseling services, sometimes psychiatric services, to substance abuse treatment resources, to long-term residential care if it's needed, educational supports, and also different community support groups that are out there. And we do offer various support groups here as well. I run a support group for parents and guardians who are in the Ronald McDonald House. We do that once a week. Dr. Majors runs a support group for parents who have children in the NICU. And then Ms. Caitlin Wagner, she also runs a Lego social skills support group for kids. So we're doing that more and more. Also, Monica Lozano and I have recently been trained and accredited in Triple P, also the Positive Parenting Program. So we will be offering parenting classes as well for those parents who have children with behavioral issues or children with anxiety. We're also looking at offering classes. We've been accredited in offering classes to parents who to prevent physical and emotional abuse, or even those who have actually physically and emotionally abused their child, mandated classes. That's something that we're looking at the end of May. So if that happens, that's something that maybe your volunteers could, come to some of these classes. I think that would be wonderful. We also work with complex concerns. So we have our community resource coordination groups, or the CRCG. This is a county-based group of local partners and community members that work with families to identify and coordinate services and supports. So we do have two members here in our department. So Sergio Garcia and Monica Lozano, they are part of the CRCG, and they're able to go in and work with just a variety of not only mental health practitioners, but different representatives from the school districts are there just to work about, maybe some complicated cases that maybe it's a kid at a school that's also been into our department, our emergency department, that's also receiving services elsewhere. Well, instead of working in silos, how can we work together to best support this child and to best support their parent and guardian? So they really are great meetings that we go to because we're all getting together how to support this person. Here's a coping plan. So this is something also that is available in our Epic. That's kind of our database that we have. So let's say that we do have a student and someone has worked very closely with this kid, with one of our patients, and they get to know this kid pretty well. Well, they're going to put it in the coping plan. So it's kind of like our cheat sheet. So when someone else comes to work with this child, they're like, oh, okay, great. It kind of gives us some cues on how to best work with this kiddo. Like, for example, here, nonverbal, right? But responds to sounds. They avoid crowds. They like dim lights. So we know when we go in there, we're not going to just turn the lights on right away, right? Make it super bright. We want to make sure that it's dim so this child feels comfortable. But we also like to, this is something we do a chart review before we go visit our kids, so we know a little bit about the child. But these coping plans really are wonderful just to get like a snapshot of that child and how to be successful with that kid. And also so the kid's comfortable when we go in because we're strangers going in talking to this kiddo. How can we best make this child, this patient, feel comfortable? So, emergent crisis and risk. So, we build awareness and we develop insight whenever there is a crisis. We do a lot of patient de escalation and stabilization. Sometimes when we have patients who come in, they can be violent. Okay. They're scared, right? They don't know who we are. Why are we asking them these questions? Some of our kids who come in here are also in a state of psychosis. They don't know who they are, or they don't know where they are either, and it's scary. So we do have to go in and do some patient de-escalation at times, which we've all been trained to do. It was a very intense training. Anyone who is not trained cannot go do this. And it is the safest way to destabilize, to de-escalate a child. We're not hurting them at all. I did the training and they made sure to do all the moves on us as well. So we can tell parents, like, this isn't hurting your child because it can be a little jarring. When you see someone trying to de-escalate your child, they're upset, maybe we're holding down some arms, but, we can tell them, "Listen, they did this to me. It didn't hurt. This is the safest way that we can provide support for your child," and to get them to calm down as well. We do intervention during family disruption and some discord as well. Sometimes our families are the reason why our kids are in the ED, right? Sometimes our families are the reasons why our kids have depression and have anxiety, and so we have to kind of go in there, especially when there's conflict between family and patient. We also provide grief support during a loss of life, either acute or maybe it's even unexpected. That's still, you just wrap your brains around that. If you've lost your child and then they have been on this journey and it is kind of expected, but when it comes, there's no way to handle that. So we want to make sure that we're able to provide support for those parents and guardians and siblings as well, and family and friends. We have a behavioral analysis as well. This is Miss Robin Blue. She's a board certified behavioral analyst. So what is that? So a board BCBA is a master's level professional who focuses on understanding behaviors and why they occur. So challenging behaviors can be minimized and adaptive behaviors and skills can be taught. So behavioral support services, what Robin can do. Behavioral support for patients on the autism spectrum, as well as outside of the neurodivergent community that aims to improve skills and reduce negative behaviors over the course of their treatment, and also work with parents, caregivers to support the behavioral needs of the patient with proactive, collaborative, and problem solving based strategies, concentrating on improving healthcare here and home safety, and also interactions between the parent and the child. Robin is also our music therapist that we have here. We only have one, and we're so lucky to have her here. So, her purpose. So, this program helps address our patients who need mental health care. It's a therapeutic outlet, it's emotional support, and it's essential part of the healing process. So, what is a music therapist? Music therapist provides treatment through music-based interventions to support a patient and their caregivers. The goal of music therapy is to help patients maximize their physical, psychological, cognitive, and social functioning. So, here are some of the interventions that she does. She provides sensory stimulation to prevent both to prevent both understimulation and avoid overstimulation of our patients here. She facilitates creative and emotional expression, aid in learning and retention of information and communication skills, improves and increase physical activity of our kids, positive and normalized social experiences. It's an outlet for distraction for our patients, which decreases their stress, their anxiety, even their pain. And then also it's patient, parent, caregiver, psychosocial support as well. And you can't miss Robin. She's the one carrying her guitar. She has her keyboard, she has her noisemakers, you can't, she's behind me right now. You can't miss Robin when she's coming, and the kids really respond so well to her. So we have Dr. Stephanie Majors. She is our with the maternal mental health program. She's one of our specialists here. So the maternal mental health program at Driscoll Children's Hospital was developed to address the mental health needs of parents and caregivers of children who are hospitalized long term in the NICU and the SICU. So the purpose is to provide quality mental health services to the parents of patients at both Driscoll Children's Hospital and the NCC located at Spawn South. So she travels back and forth during the week. What she does is she provides individual counseling to the parents. They actually come in here and she's able to visit with them once a week, once every other week, and provide that therapeutic services to them. She has her group, as I mentioned before, and the parents love to go, and there's always some fun activities, lots of bonding time. And then the postpartum depression, she does those screenings as well, just to make sure that her mamas are safe and that her dads are safe. So, me, as I mentioned before, I work with our school-based mental health specialists. I said they provide therapy during the school day. We are at Corpus Christi ISD and Gregory Portland ISD, and we are looking to expand, of course. So, constantly looking for grants, people to come in and do some sponsorship as well. So that way we can go into more schools and offer these free services. And then we have Miss Haven Wright. She is our art therapist that we have here. So the purpose of this program helps address our patients who need mental health care, therapeutic outlet as well, emotional support. An art therapist, so she's here. She works trained in visual arts and the creative process, human development behavior, so psychology, mental disorders. So what she does is accessing nonverbal means of communication. Some kids who can't talk, they can draw, right? They can express themselves that way. Creative, judgmental space for self-expression, decrease anxiety and depression, also helps with discomfort and pain management, emotional attunement, regulation. It empowers kids also as well. She does grief, trauma debriefing and support, identify healthy affecting coping skills, increase autonomy and self-esteem of our patients here, processing hospitalization. That's a lot for a kid, right? Why am I here? Processing their medical diagnosis as well and their treatment. She can help them process all of that. She helps with stress management, and she also helps kid relax. So she actually has a couple of patients that come in here. She's just located right next door to me, and the kids love it. They do not miss those appointments. And she really is making a difference with our children here at Driscoll Children's Hospital. So I know this is kind of short and sweet, and I'll open up for any questions, but this is our contact information. Here is our main number if you do want to call any of us. If you don't feel comfortable asking questions right now in front of everyone, you can give us a call. Lisa McKenna is our direct supervisor. And that's mine, my email. So that is an I. It's not Lee Yeskis, it's E Yeskis. So it's IY, but please feel free to email me. And then Monica Lozano, as I mentioned before, she is our mental health educator, but she's also a mental health specialist as well. And so if one of us can't find the answers, we'll refer you to someone else and we will help you to find all the answers that we can. So I will stop sharing and I will open it up to anyone who may have any questions or comments.
So I just had a question.
Sure.
You kind of mentioned the kids that y'all work with, right? So do they have to, I guess, utilize the ER to get the service, like, I guess, then have that support from y'all?
So sometimes, yeah, for the majority part, yes, they do because we don't really go out in the community
Mhm.
unless we're in the schools. They're in the schools. But what we do have is, and we love this, is that people who know who we are calling us now. Some of our schools are calling us. Listen, what do we do with this child? Should we send them over here? Should we send them straight over to Bayview? What do we do? So we're able to provide, kind of indirectly to provide that support as well. Right now, we're meeting with our CCISD PD department so we can work better with them. We can kind of streamline our services because a lot of times they're the ones who bring our kids here from the schools as well. So yeah, it's pretty much our kids who are here. Now we do have like, a psychiatrist department where kids can go in and receive services, but we're not there yet. That's something we're working toward. We are working toward outpatient services and hopefully we'll see that, happening pretty soon. But as of right now, we don't have that.
So I have a question. And so you're with
Yeah.
Driscoll Children's, right? So
Mhm.
when we have so as of recently, like I had a child who was placed with a family member, and this is a new removal. Child has she's on the spectrum, but
Mhm.
she can become violent. She's not on any medication because she's new to the foster care system, right?
Yeah.
So they did take her. They did call the hotline, not the CPS hotline, but the behavioral one or tropical, or I can't remember what it's called,
Okay.
to try and get some assistance. And then when they took her to the hospital because she wasn't in crisis at that moment, there was nothing they could do to help her, even though as soon as she returns back home, the situation's different. Should we be telling our families, like, take them to Driscoll ER versus, like, because I normally didn't take them to any ER?
If, in the same thing here in the ER, they'll do a mental health assessment on the child. And unfortunately, if a child says, the right things, or they score pretty good on any of the screenings, we would send them home also. It's only if they're presenting with like suicidal ideation, they have a plan, they have intent, if they have homicidal ideation as well. If they're in a state of psychosis, then we can offer that help. But yeah, I've been down in the ED and I've sent kids home as well. We always send parents home with resource packets, though. It's a pretty lengthy resource packet that we do give them. We give the parents our number here. So sometimes parents call us like, listen, I don't know what to do. We'll bring them here. We tell them that, if a kid is presenting and it's pretty serious. Otherwise, we do those 7-day and those 30-day follow-ups. So if they come to the ED, we also make those phone calls as well, just to make sure, just to do those check-ins.
So we should be recommending like Driscoll Children because normally it's just like whatever hospital's near. And
So,
honestly, that in my head, just
yeah, sure. I mean, we have a whole behavioral health department, and that's what we do. We work with these kids, and we can provide them to the necessary resources if they do need outside resources. That's 100% what my team does. So, great question.
And so y'all don't work with, because like I know the pediatric center is next door. So
Yeah,
y'all don't, that's what I'm
we're not
saying.
over
Like,
there.
y'all
No,
don't
but
work like,
no, but they can always refer a child over, to our
okay.
ED, and then we can get involved that way. But no, we're not actually going into that clinic next door.
But they, like a doctor could refer
Oh
like,
yeah,
hey, okay.
yeah, definitely.
Hmm.
Mhm.
And anybody else have any other questions? No. So I will provide information to our volunteers. Anytime that they're like, hey, like I know I remember, there was this one. I usually make sure I have all the contact information. But if there's anything that you have that you want to send over, usually sometimes I'll just forward whatever. So if you have any like pamphlet or something that you want to share with the volunteers, I can send it over to them in an email, and that way they have it as well.
That
But
sounds great. I'll do that. I'll get some stuff sent over to you guys.
awesome. I do appreciate you taking the time to speak with us, speak with our
Yeah.
volunteers. I do hope that you have a good rest of your day, and volunteers, I hope that y'all have a good rest of y'all's day as well. Thank you so much for attending this training. We'll see you in 2 more weeks.
Okay.
Thank
Thank you
you.
so much. We'll be in
Thank
Thank you
touch.
so much for coming.
Thank you.
Bye-bye.